Welcome back. We're here at the Pain Diaries. Dr. Matt WIEDERHOLZ and I are here to talk about why do you want to come to a pain management specialist? So over the years, pain management has had a bad rap in the United States. Some people have a negative connotation when it comes to seeing a pain doctor. Why do I need to go get pills? Why do I need to see a pain doctor? And I just need surgery. I just need to get better with surgery, and I don't want to be hooked on opioids. So I'm here to educate you all on what we do. Now, pain doctors are the bridge between your primary care doctor and the surgeon. Our goals at Performance are to treat you to keep you functional, and if you really need to have surgery, we refer you to a surgeon. We know amazing surgeons, and we work collaboratively with them. Dr. WIEDERHOLZ, can you add to this about what's been going on over the past few years with the opioid epidemic, and how we are trying to curtail that, and then also add to elaborate on why we refer to surgeons when we need to?
Yeah, I think this area, it's a complex topic because we're talking about opioids. The government has involved themselves in pain management over the years. If you think back, you may remember during your med school days that pain was the fifth vital sign. And so hospitals were graded on how well they performed at managing people's pain while they were in the hospital. And so there was a huge push to make sure that patients' pain was adequately addressed when they were in the hospital. And that bled over even into the clinic. And so the use of opioids just skyrocketed. And as a pain physician, we are obviously the most well-equipped at dealing with both acute and chronic pain. And that doesn't necessarily mean the use of opioids. If you look at the specialties that are most known for prescribing opioids, pain physicians are way down on the list. And so the primary care offices were flooded with people demanding that their pain be better controlled. And so opioid usage just went through the roof. Then came interventional pain management. And so Dr. Manzi and I, as interventional pain physicians, offer alternative solutions, things that don't involve just popping a pill, and trying to actually get at the root of the problem. And so if you have, say, a bad disc that's causing inflammation and irritating a nerve, we can actually place a small amount of medication directly on the problem area and solve the issue most times without the need for dangerous medications that may cause addiction or other side effects and problems. Additionally, you don't need to jump straight to the surgeon because many of these conditions are easily treated with a combination of injection treatments and physical therapy and other modalities. And I think that as interventional physicians, that's really what we're pushing, is a move away from, hey, just take these 2 pills and call me in the morning, versus let's try to get to the root of the problem.
Absolutely. Like I mentioned earlier, we work with surgeons, and if you have to have a surgery and need pain control, we're there for you. But our ultimate goal is always to hopefully prevent that spine or joint surgery. One of my favorite procedures is neuromodulation, and I know you're very passionate about this too. Now the question is, what is neuromodulation? Neuromodulation is basically tricking the nervous system to think that your pain is felt differently. It's almost like a filter between your brain and where the problem is. Now, neuromodulation can be in the spine or over the joints now. You can treat a nerve that goes to a joint so your brain doesn't think that joint is painful anymore. Again, so many different options these days are available to keep people functional. And it's really amazing with small little incisions and or, like you mentioned, a keyhole type procedure. where you don't even need sutures sometimes, where we perform these minimally invasive procedures so you don't actually have to have a large operation on your back or joints. It's really been an experience to learn all these techniques, and we're very proud to serve our patients and offer these technologies to them. The other thing I wanted to ask you, with neuromodulation, maybe you can elaborate more on spinal cord stimulation and the different types of spinal cord stimulation that we utilize in our practice.
Of course. Spinal cord stimulation is essentially targeting nerves in the central nervous system, so in your spinal cord. There are receptors that control pain in various parts of the body. And so one of the most common ailments is low back pain. And oftentimes, patients that present to an interventional pain physician have already had prior back surgery, and they may still be suffering with chronic back and or leg pain. And with the implantation of a tiny little device, it's about the size of a spaghetti noodle, that little wire or spaghetti noodle can deliver electric impulses to the nerves to essentially block pain signals. And so instead of dosing medication, we're actually dosing electricity in order to modulate the central nervous system. And we do that in an effort to reduce pain. And what's been found in recent studies is that about 84%, 80 to 85% of patients respond favorably to that type of stimulation. And so that's an incredible number of responders to that therapy. You can't really say the same thing about most medications. Most medications, in fact, get approved by the FDA for very marginal benefits over placebo. But an 84% responder rate, and in those same studies, there was about a 7 out of 10 chance that you would be a profound responder. What does that mean to be a profound responder? Essentially, that means more than 80% pain relief with this therapy. That's incredible. That's essentially total elimination of your pain with just a small implantable device that simply stimulates the nerves of the central nervous system to block pain in your back and legs. I think that's incredible.
Absolutely. It is one of our favorite procedures to do because the patients know almost immediately that their pain is relieved, and they're just so thankful and grateful. One of my favorite things to do is put the lead over that little nerve root, and when they have specific pain called complex regional pain syndrome, this is really targeted spinal cord stimulation. It's electrical signals over that small nerve root, and it can deliver pain relief for a very specific reason, whether it be foot and ankle pain or knee pain from a surgery, hip pain. I have a patient that had a femoral artery catheterization, and the femoral nerve was cut by accident, and he's had continued leg and knee pain. And he's just had tremendous relief with this new therapy that we have to offer him when it comes to neuromodulation. One of the other types of neuromodulation we use frequently is, like I mentioned, stimulation over the nerves that go to joints. Can you tell us some of your go-tos for shoulder pain, knee pain, SI joint pain as well?
Of course. Using neuromodulation, and that's a fancy term, neuro for nerve, and modulation I think is pretty self-explanatory. Using that type of technology outside of the central nervous system now opens this technology up to a plethora of ailments. And so you mentioned shoulder pain. Let's just focus on that, for instance. There are tons of people who have had shoulder surgery or shoulder replacement even, who continue to suffer from chronic shoulder pain. What can be done for these people? There's little that a surgeon has to offer. They've already done the operation and there's still pain. Well, the good news is that the shoulder joint is innervated by nerves, and those sensory nerves control whether you feel pain or not. And those sensory nerves are now an area that we can target to block, either with injections or with heat or cold therapy, or in this case of neuromodulation, using a device to stimulate that nerve in order to modulate the signals that are coming from that nerve. And so instead of your body and your brain interpreting those signals as painful, that's now dampened down, and now you don't feel it as such severe pain. And I think you as well have had tremendous success with these therapies and taken patients with just long-standing chronic shoulder pains to essentially elimination of their pain.
It's been phenomenal, the results that we've achieved at Performance Pain and Sports Medicine using these technologies. And I'm so grateful, again, to be part of this revolution in the pain world. And being a pain physician has never been what it was in the past. Now we have all these new technologies that allow us to keep people going and keep them functional and reduce their pain levels. On another note, the other thing I love about what we do is, like you mentioned earlier, we treat degeneration of discs and or cartilage. And so using regenerative medicine, it's another great way to keep you out of the surgeon's office. Instead of having things cut out or repaired by a surgeon, we can repair things with just a needle, an injection of regenerative type medicine. Can you elaborate more on what we utilize for regenerative medicine?
Yeah, regenerative medicine is an exciting field. You see a lot of buzz these days about stem cell therapies, and there's just a lot of confusion out there on what these therapies are, what is a legitimate treatment, what is not. Regenerative medicine is actually not a new field. George Hackett published the first book on prolotherapy, or proliferative therapy, which is a form of regenerative medicine using sugar water or dextrose back in the 1950s. So this therapy's been around for a very long time. I myself have been doing regenerative medicine for 15 years now. So this is a long-standing passion of mine. And as we mentioned earlier, one of my board certifications includes anti-aging, regenerative, and functional medicine. And so a field that is completely focused on rebuilding or regenerating the body. And that type of therapy can be applied in orthopedics in a way where instead of using medications that cause further degradation of the joints, or using surgeries that cut out pathologic tissue or degenerated tissue, we're going to allow the body to naturally heal itself. Well, how do we do that? First and foremost, the two of us, we focus on nutrition. So that's a big part of success in regenerative medicine. All too often, I see clinics that offer quote unquote regenerative medicine, and all they do is a shot. They don't talk to the patient about their nutrition. They don't optimize hormonal balance. As we age and we degenerate, we also see a decrease in our anabolic hormones. And so things like testosterone, estrogen, progesterone, these are anti-inflammatory hormones that in our youth are in optimal ranges. Well, it's no surprise that in our youth, we're not degenerating and we're very healthy and our joints aren't aching. Well, as we age and these hormones decrease, inflammation takes over. And just like in cardiovascular disease and cancer, most things start with inflammation, uncontrolled inflammation. And with regenerative medicine, we can utilize growth factors and even cells to stimulate repair of degenerated tissues, of torn tissues. But in order to optimize that, we look at nutrition, we look at hormones, and optimizing all of that for the most beneficial outcomes with regenerative medicine is really critical.
Regenerative medicine has been such a fun field to jump into and learn about. I really have also found a passion for this because if it was my body, I wouldn't want to have a surgical correction when there's ways that it can be treated and healed naturally. I feel like we're all looking for a way to heal ourselves and to feel better. And in order to not have to take time to recuperate from a large surgery or have that time off that we just can't afford if we're trying to run a business or trying to spend time with our family and do what we need to do as busy Americans as we are. So again, I love having these treatment options to offer patients, and it's our job to continuously educate them. And education in our office is just a daily part of our job, patient to patient. We're always educating, recommending what people need to stay functional. And another interest of mine is going into this obesity medicine specialty because, again, it's so important. Fat cells are highly, highly inflammatory, and a lot of people don't even know that. And if we can reduce our inflammation overall, we're going to feel better. Like Dr. WIEDERHOLZ said, it's of utmost importance to feed your body nutritious food, nutrition, good supplementation, and again, if something starts degenerating, we have the options to fix that from a non-surgical approach. Dr. WIEDERHOLZ, can you elaborate more on how we administer the hormone replacement therapy?
So hormones, when our hormones diminish over time, so in women as we approach menopause, and in men the process of testosterone loss in andropause, that process in men can take many, many years, and so it's not as noticeable. In women, we sort of go over a cliff, right? You approach menopause and you start to get all of those symptoms really rapidly, the hot flashes and all of the other unwelcome symptoms. Well, there are a number of ways to replace those hormones. Of course, I always recommend talking with your doctor about these therapies. Some of this can be controversial. However, with bioidentical hormones, these have been shown to be exceedingly safe. There are a number of different formulations. So some folks are taking oral hormones, some are taking topical hormones. But what I'm really passionate about is using pellets. These are subcutaneous, meaning under the skin, implants that last for months. So rather than having to remember to take a pill or put a lotion on your body every day, and the risk of potentially transferring some of those to loved ones from contact, a pellet is inserted under the skin, and it's a very safe procedure, and it optimizes these levels and keeps them in an optimal range for a very long period of time. So you don't have to remember to take your prescription. You simply get the procedure done, and then in most cases for women, 3 to 4 months of hormone optimization seen with pellet insertion. And in men, we're seeing anywhere from 4 to upwards of 6 months of optimized levels of testosterone without the fluctuations of taking a shot or a cream. I think most men who have used topical formulations of hormones of testosterone have noticed that they don't get the tremendous benefit that they feel that they should be seeing just with a topical formulation. But when you put the pellets in, within just a few weeks, the levels are optimized and people are just feeling great.
I really feel it's so amazing when they do come back after they've had their first round, or if they actually go too long and don't get them, they come back and say, I need my pellets, I miss them, I want them. They're so adamant about feeling amazing. It's been a great addition to our practice in adding this therapy to make people's chemistries normalized and optimized. And you know, we're proud to offer that at Performance Pain and Sports Medicine to make everybody feel like they're young again. So on that note, it's time to go to a commercial break. Remember, you can follow us on Facebook, Instagram, and LinkedIn. To make an appointment, call 346-217-1111 or email info@performancepain.com.